everyone, and welcome to another episode of Inspiring Careers. My name is Dan Johnston, and I'm here today with another fantastic guest. His name is Lee Finlan. He's an MSL Director for Europe, and he most recently won, in 2014, the Pharma Times MSL of the Year competition. He came in bronze place, and that was the very first MSL of the Year competition that had happened in the world. Good afternoon, Lee. How are you doing?
I'm very well, thank you, Dan. Good afternoon.
What is one of the toughest problems that you have faced in your current role, and how do you think it could be solved?
I'd like to talk about an example of, as you're going from being an MSL, senior MSL, to ultimately becoming a manager or more senior where you're looking after and leading teams. I think one of the key aspects where I face some difficulties and challenges is that when you have ideas and when you have passion, you really need to establish that relationship with people who share that type of energy, that type of optimism. Sometimes if you're not at the right company at the right time, you can face barriers because you can be your energy to drive positive change, which is of benefit to the company, to your team, to yourself, and ultimately to patients, can sometimes be perceived or misconstrued, and you can be seen as a go-getter who wants to get ahead, and you can be labelled and branded a little bit as a threat. And I think that's sometimes an area where, if I reflect upon my past, how do you manage and how do you deal with that in the right way to try and overcome those barriers? And that there can be different solutions to that. Sometimes just being patient, or putting ideas out and letting people take those ideas as their own, and ultimately developing a relationship is the right way. Sometimes you might not be at the right company, and I think that's where you need to consider: are you feeling valued? And thereby consider job hopping. Go to another project with a new team where you might have impetus, where you not necessarily have those barriers to you feeling fulfilled and ultimately satisfying some of your career goals as well, and thereby delivering on some of those key things which you're passionate about. Because where you're passionate about, you tend to work 2 or 3 times harder than when you're dispassionate, and I think that's really, really key.
What has been your most favourite career achievement? What do you look back on and think, yes, that was absolutely brilliant?
The one which I think was really, really compelling and stood out for me was when it came to Pharma Times being acknowledged and going to the final for that. Why that occurred, I was recommended by several healthcare professionals, both nurses and clinicians. And the reason why was because of the approach which I took. I was involved in a team and in a project where it was a drug which was highly efficacious, but it also had some very significant safety risks which you needed to mitigate and manage against. And the medical liaison team was the team to increase awareness and to support programs to monitor patients, to put safety first and to put familiarity and confidence of knowing how to use that medication at the forefront of the project launch. The medicine was being launched, and just before launch we were doing that. And, there were 3 or 4 incidents where the medical liaison work clearly affected outcomes of patients in terms of safety events, where the events were picked up early, they were mitigated and managed, and ultimately the patient reaped the benefit. So it kept the risk-benefit profile drastically in favour of the therapy and continuing with that therapy for the patient. That's an incredible feeling. And, when you clinicians and nurses are really thanking you for your work, it makes you feel very, very humble. So that's what led to the Pharma Times Award, and ultimately I represented that felt as safety is sexy. That was my strategy for the Medical Science Liaison. Everything which I represented there was not focused on the mode of action or this drug is so great. It was focused on it has compelling efficacy. But what I want to talk to you about is the safety aspect and show the responsibility on the side of that. And that's very good for a company's reputation. It's very good for the industry at large, and ultimately, it's very satisfying to be able to have a sincere and frank conversation where you're not avoiding talking about controversy. You're saying, hey, this can be managed. You're medical professionals, and we want to do is to support you in that, and it fosters a confidence. So that for me was a hugely eureka moment for me, where I felt medical affairs is where it's at. If you are truly in the right company where they are research interested, they have ethics, and they want to do things correctly.
What's the number one thing that you see that is holding other MSL directors or other senior MSLs back from being truly successful?
I think there's a few things. I think we talked about job hopping earlier on. I think I've seen many senior medical liaisons who've been established with one company for a long time in big pharma. And, what can often happen is that you can become kind of institutionalized if you've only seen one company with certain types of strategies. I've been fortunate enough to work for two big pharma companies, quite a few medium-sized and also small pharma companies. And what you actually can find is sometimes in the smaller companies, they have to be more innovative because they have less resource in terms of funds or sizes of their teams. What comes with that innovation ultimately can be really, really refreshing in terms of new ideas, new ways to engage, etc. One of the biggest barriers is that people get comfortable in that, and ultimately when they do, come to another company, they just want to reinvent big pharma in a smaller environment, and that's often a barrier because people can come in with very good reputations and with high expectations, etc. And within 6 months, it can come undone. And the reason is because they've not adapted to the new environment. They've not learned. They've just looked to kind of recapitulate what was good practice in big pharma. And I think that is a key area where when people make the transition, being more mindful of that is it's important. Pick your winners. Some of the stuff big pharma does is great, but some of it just will not work in that model. I would say it's not about metrics. Metrics are important. If you're not active and out there, then you're no use to anyone, either healthcare professionals, patients, and also the company. But it's about the quality of the engagement and the quality of the projects, which as a medical team, you're going to execute yourself, but ultimately you're going to formulate in a well-considered manner with your team, with your managers above you, ultimately with a key and clear, medically appropriate aim, and then execute on that, well. Some people get bogged down in compliance, right? In my view, sometimes you'll hear people say, for an ED life, they'll pull yellow cards and red cards out about compliance a lot. And I would say 90% of the time, those compliance concerns are actually invalid. And they're usually invalid. It's usually for reasons of insecurity, of unfamiliarity, where people raise some of these concerns. But some of them are valid, and some of them actually need to be sanity checked as well. But that can be stifling if you want to develop your career. You've got to think about, is this ethically the right thing to do? Is this promotion in disguise? If it is, it's absolutely a no-no. Is there a benefit here to keep people? Is this about research, furthering research? What is the aims and intentions? If you've got those things right, everything else falls into place.
What is the final piece of advice you would give to any other MSL director out there who's watching this right now?
I think you've got to your position because of your prior experience. Okay, that's got you to your present position, but that will not sustain you for the future. So I think continuing to keep an open mind to learn and to adapt is really important. So that's really important. I think the second thing is are you are you a manager? Are you a director? What do you want to be? Or do you want to be a leader? For me, I want to be a leader, and I think you lead people by having positive energy, and that people can clearly see that you're sympathetic, that you understand, that you've been through similar battles where your experience can help them. And ultimately, you have to bring people with you. So I think look around. Are people following you? Or are you a manager who dictates, who executes and commands, and is very isolated from that team? How do you feel your team might feel about you? Are they passionate about you? Are they with you? Do they respect you? If for someone to speak about you when you were not present, that was not maybe in positive light, would they defend you? These kind of things I think are important to bear in mind, and always just try to be yourself and try to be as fair as you can be, but ultimately don't lose the passion and the reason for why you're there.
Lee, it's been absolutely wonderful speaking with you today and learning everything that you've got to share and learning about yourself. If you really enjoyed watching this video and you want to find out more, you have any more questions, Lee, are people more than welcome to connect with you on LinkedIn and just drop you a question here and there? Would that be okay?
That would be absolutely fine. No problems at all.
Cool. So if you want to learn more, if there's anything Lee spoke about that you would like to just ask a question or two about, then just get in touch on LinkedIn. Likewise, you're more than welcome to connect with me, and I can try and pinpoint your question in the right direction as well. Thank you so much for watching. Please do like, share, subscribe, or comment in this video below. Once again, just thank you very much, Lee, for joining us, and thank you for everyone watching. All right, cheers. Thank you very much, Lee. Take care.